So welcome to HCRF Talks COVID with week 3 with Dr. Platanias, and we're so thankful to have him here. We know that you're here, Dr. Platanias, because you care about cancer and you care about helping people understand COVID. So thank you for being here. Hello. I also want to welcome Eleni Boussis and HCRF board members. It's so uplifting to see everyone here together. From the start of our foundation, we've come together to provide so much hope, and COVID's not going to stop us from caring about cancer patients. So hello to all of you, and thank you for being here. This week, we actually reached 1,000 deaths, actually surpassed 1,000 deaths due to COVID in Chicago. This is pretty devastating when you think that each of those deaths not only represents a statistic, but each of them represents a mother, a father, a sister, a brother, a loved one. We know that this number could have been a lot worse just from looking at the aftermath in other cities. And we have frontline workers at Northwestern and all throughout Chicago to thank for curbing this COVID crisis. A few days ago, as I mentioned last week, I have 3 little ones. And a few days ago, my 3-year-old came up to me and said, you know, he was so frustrated with being locked down and with having to do homeschooling. And he goes, "Mom, why can't we just hit the coronavirus over the head with a hockey stick?" And this made me think, and I think it amazes me that in this day and age, we still, with all the medical advancements that we have, this coronavirus, this relentless virus has us all stumped. It has the whole world stumped. And on that notion, Dr. Platanias, I wanted to bring this idea about antibody testing. And I think this idea of antibody testing has the whole world stumped as well. We've heard political leaders talk about how the reopening of the country will be facilitated by this antibody testing. We all have friends and family members that are running to go get tested for antibodies, all of them thinking that this might provide some kind of an immunity passport, maybe let them feel more free to go out into the public and not wear a mask. Can you provide us some insight into understanding what it would mean if someone did test positive, and also the reliability of these tests?
So I was actually earlier today in a panel with other doctors talking exactly about this and the up-to-date information. So antibody testing, you know, in some other cases, it may be a way to see if someone has immunity if we know that the antibodies are what we call neutralizing, you know, if there are neutralizing antibodies. But in the case of COVID, we don't know that at this moment. All we know is that people who get positive antibody testing, and there are now several tests out there, most of them have not been evaluated carefully by the FDA yet, and by, you know, careful scrutiny, but there are there. And if you have an antibody positive, it means you have had COVID at some point. Could be that someone had COVID without symptoms, may mean someone had COVID with real symptoms, but we don't know how protective that is. And that's very important because there is no immunity test this moment. There is a good chance, that's what I believe, that people who have antibodies, there is a good chance that these people are protected, will be found to be protected for a while at least. It doesn't mean when you get immunity, it doesn't mean that you get immunity for life. That's why sometimes when we do vaccines, we have to go and give boosts, give a second dose later, or repeat it in a few years. But for sure, antibody testing means that there is exposure. So that's where it is. So there is no guarantee that this proves immunity. There is no guarantee that, you know, this means you can go and do whatever you want. Absolutely not.
So does that mean if someone tests positive for the antibodies, it's also possible that they can get reinfected?
Yes, it is absolutely possible. This moment, with what we know, in some viruses that happens. You may get positive, you know, you may have antibody, but the antibody is not what we call neutralizing. It doesn't kill the virus, or it takes, you know, or is not high titer, is not sufficient enough to fight. But there is a decent chance, and that's what studies will show, that some of these people will have immunity, or maybe a lot of them. So we are participating actively in this study with the National Cancer Institute and the National Institute of Infectious Diseases, and we are helping them all together. We're sending them samples now from patients, from COVID patients that we see at Northwestern, and controls. We have control samples that we have collected over the years, and they're trying to address these questions. So we're collaborating with the National Institutes of Health on that.
So it's providing some kind of hope then, at least.
Yes, it does. Another important thing that people don't talk right now so much on the news, but that's going to be probably the biggest breakthrough, is what we call antigen testing, not antibody, antigen testing. So what is antigen testing? Antigen testing is right now the only way to diagnose COVID is to go and put this thing in the nose and try to take a nasal swab, right? And that has about 70% sensitivity, meaning that if you take 10 patients who have COVID and you do the test, only 7 will come positive. The other 3 will still have COVID, but the test will come back negative. And that's why one negative test we don't take it as negative, we go and repeat it. Mm-hmm. And we have seen patients being like twice negative, and then the third time are positive when they're very sick. So all these tests are not perfect. That's the whole point. So antigen testing now is what we have for some other virus, for hepatitis, for HIV. What that measures is a blood test. Instead of going and putting and you can measure an antigen, a part of there is a test that can detect a part of the virus, of the live virus. And when that happens, that test doesn't exist right now. And if you watch Dr. Birx the other day, she was trying to challenge universities to try to get this as soon as possible. When this happens, diagnosing COVID will be much easier than it is right now. And it will be much more accurate to follow the disease, So it is still a lot of stuff up in the air. The antibody tests are there because they were the easier to develop. We don't know what exactly they mean, but there is other pieces, other tests that need to happen, like the antigen test,
Well, that's encouraging then that there's something in the works. At this point, can I welcome HCRF board members to join in? Questions?
Dr. Platanias, can you hear me now?
I'm not muted. Can you hear me?
Okay, yeah, I can hear both now.
Okay,
yeah.
let Mr. Lovatetis go first.
Oh, okay, okay, sorry. I beat you to it, Eleni. I beat you to it. Okay, so the question I have is, it looks like yesterday the governor of New York was making his annual or his daily presentation and talked about how a significant percentage, I don't know, something like 70, 80% of the people that are checking into hospitals had never been outside the house. Somehow they've caught it out of the house as opposed to some other way. How is that explained? That's very puzzling, isn't it?
I didn't hear his exact comment. I didn't watch it, but he said these were people who were staying in the house and they still got COVID. Is that what he said?
Yeah, they presented a chart, and the chart said, okay, when they checked into the hospital, they were asked, where have you been? Obviously a small percentage were traveling, some others were doing something else. It was like an incredible percentage, 60, 70%, whatever it was, said we've been in the house and we haven't, we've been sheltering in the home.
Yeah. So, this is, first of all, an obvious question that we see also here in Illinois. We have been now for how many weeks? The lockdown, the stay-at-home order has been going on now for 7 weeks, if you measure, and the cases are still going up, right? If you go and look the Illinois data, we still are going up. The curve has not been flattened, still going up. So there are 2 possibilities for this. One is in New York and Chicago to some degree, there are very dense areas, right? So you may stay in the house, if you live in an apartment building, if you go to the elevator, let's say, and you don't have a good mask, you may have a mask, but it may not be a good mask. There are data that came from China, from Wuhan, that showed that virus can stay in close spaces on the air for a while. So one possibility is in very dense cities like New York City, and to some degree, some parts of Chicago, because of these big apartment buildings, there is always the risk that there is some virus in the air. You may think you're not going anywhere, but just walking, you may just go to take the elevator to go to pick something, your mail, and that, I don't say this happens, but that's one possibility. Then there is something else that is even more worrisome, that has gone wrong from the beginning. At the beginning, when we were saying like people got infected, right? And we were saying that they should go on a quarantine for 14 days. And that's what we were saying. You come from Italy, you go and don't go out for 14 days. So the theory was that people within 14 days, you will either develop the virus or you will be clear from the virus. This is totally wrong right now. In fact, we're doing in our place too many tests this moment. There are many people who are positive at 35 days, 40 days, like a lot. The official line is that people can transmit the virus up to 40 days later. And we have seen, and again, it doesn't mean that everybody will be infectious for 40 days, but we see it all the time. Yesterday, we're going over cases, and we had people who had 35 days later, 37 days later. This virus drags for a while. The tests are not great. There is no great test anywhere in the world. It's only 70% sensitivity. So sometimes we may think someone has become negative, testing negative, but may not be negative, because you need, in fact, for the cancer patients in the cancer center, because we have patients with cancer who get COVID, right? So what we do is, if we want to make sure that they got cleared, we do the COVID test. If it comes back negative, we don't trust it. We repeat it. It has to be repeated. We need to have 2 COVID negatives within more than 24 hours from each other. So there are these 2 possibilities. One is that it drags for a while, and we have not realized it. And the second one is the dense, close spaces, And there could be something else that we don't know, but this is a weird virus,
For sure. Thank you, Dr. Williams.
Dr. Platanias, how are you, everyone? Nice to see everyone together. We miss your faces. I like the red tie, Dr. Platanias.
Oh, you see? I did that for you, Spasia.
I know. I kind of guessed that. You're talking about the antigen testing. Is that the testing that the Germans are doing, and they say that it's very promising?
They may be doing research, but there is no full approved test this moment. There are many people trying to develop this test. And I suppose the Germans too. I don't know the specific thing. There may well be. There are people in Europe, but there is no test this moment that you can just do it and know it's working. It's a much more difficult test, but it's extremely promising. If that works, then it's going to be much more reliable to diagnose COVID.
BBC 2 days ago talked about this. It talked about the antigen testing that the Germans are doing, and they're also doing it in Oxford. And they said that it's very promising because they have 600 people on this right now, and they say that it's very, very promising. I'd also like to ask a question, please. Statistics are very deceiving and very inaccurate. And like myself, my kids are traveling today to Europe. And in one sense, I was hesitant in letting them go. And in another sense, I said, well, it's up to God, and may God be with them until they arrive. But when you hear statistics, and statistics say that, okay, we have 68% increase. Then all of a sudden, I don't know if you heard this, World News 3 days ago said, no, the statistics were off because they were double marked. It's only 38%. So how accurate are really the statistics? Because every state that you hear, every governor you hear, every politician, it doesn't matter whether you're a Republican, a Democrat, a liberal, or a communist, or a socialist, whatever you are, you hear so many different statistics. You turn on one news channel, you hear 60%. You hear the Nightline, it says 68%. Then you hear another channel, it says, no, 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 they were double checked, they were double assessed. Therefore, it was recorded 2 times for the same person, it's only 38%. So what is it really? People are getting extremely confused and really agitated.
You see, statisticians are like lawyers, you know. They can come up with anything you want, you know. I personally don't, you know, and we deal with them all the time because we report statistics. You have to have statistics when you do trials. All the time we deal with them. And I personally hate statistics. This is not very scientific, what I'm saying, because there are about, you know, dozens of different types of tests you can apply. And depending on how you can apply it, you can, you know, come up with a positive margin you want to see. So that's why we have very strict criteria and we have committees, because statistics are a dangerous thing. So I don't know now this 64, 68%, what that was, but clearly it also depends what you compare. It's not only the different tests that can be applied to statistics, it's also what you compare. Do you, in some, I don't know, this 64 and the 38 may not be apples and apples, it could be apples and oranges. But I will just look at the absolute numbers. The absolute numbers never lie. You can just look at them and you can see them. There are many websites that show the daily new cases and the daily deaths that you see with absolute numbers. So
I agree with you when you're saying that, but when you hear, yesterday, I was speaking to a friend of mine, and I don't know why everybody's pushing that everyone that dies from COVID. It's documented as COVID. A friend of mine's sister passed away from a brain aneurysm, and the report said COVID. She demanded that they change it. She said that she did not die from COVID. She died from a brain aneurysm. Yesterday, there was a whole feud, and it was in the news, of a policeman dying, and they said COVID. And the man says it wasn't COVID. He was involved in a horrific accident that he got crushed. He did not die from COVID. So why is it that the medical facilities, the government, I don't know who it is pushing that everyone that dies is COVID, 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 COVID? When we know a lot of people have been very vocal about this, saying they're not dying from COVID, and yet they're documenting them as COVID.
yeah, I don't know these specific cases, but most numbers that we see, both internationally and nationally, are, you know, there may be cases like if it was an accident, that cannot be COVID. I mean, how can if you got killed in a car accident, it's a car accident. I mean, you cannot make that up. I mean, so, but there are, you know, this virus causes some very weird stuff. It affects the heart. It causes clotting of the blood. That's a very serious thing that it does. And there were even cases of young people who get strokes in their 20s because, and there is a good explanation for that, because this virus clots the blood. Now, I think the most accurate numbers is just by looking, and this not data exists, at the ICU, intensive care unit hospitalizations. Most patients who die from COVID, and that's the almost 100% of them, like 90 something, whatever, they go through an ICU. You know, they get admitted at the beginning, they have mild symptoms, then they end up in the intensive care. So I think these cases are clear cut. There is no question at all, because they went through a process, they had COVID, they went into intensive care, and that's what most of the cases are throughout the world. In the US, we're not doing, you know, so bad with mortality. I think we have less mortality per number compared to other countries, and that's expected because we have good hospitals, we have good medicine. In New York, the mortality was higher because the system was overwhelmed, you know, it just crashed, and that's the danger of this thing. But in Chicago, the mortality we have at Northwestern is extremely low. We are one of the best. We have a mortality of about 4.5%. Which is for people who go in the units. That's a very low number. All I'm saying is that is not, I don't know these situations, but there is the objective numbers, which is people going in the units. And as a country, the US is doing pretty well in terms of mortality. Although we have many cases, we have very good hospital system and good medicine, and I think we're doing better than other countries. So.
Now, can I ask you another question, please?
Yeah.
They say that I don't know the statistics, but this is what they say.
Yeah.
They say you hear different channels and you get different reviews about everything. That between 60 to 100,000 people die from the flu every year. And people argue, they have an argument that says we have never compared statistics with other countries, how many lives are lost in other countries, so we could compare if it's the same amount with the COVID. So how could we say that COVID-19, since you said everything's COVID, SARS was COVID, everything's COVID, but this is COVID-19. So how can we make an accurate statistic that this is how many people have actually died globally when there was never a comparison of how many people die every year from different countries from the flu?
Yeah. So I don't know about the flu, but the flu in the US kills about 25,000 people every year. COVID has already killed 75,000 in a much shorter period. And this is numbers that we know here. So clearly in the US, I don't know about other countries, COVID is like much, much worse than the flu. And I know there have been theories they're trying to say, oh, it's not because it's widespread the virus and all that stuff. That's not what the data shows so far. Maybe in theory, someone may be right as a theory, but at the practical level, we never get from the flu 75,000 deaths within such a short period. That's a fact, it cannot be denied. So the other thing that's the big difference between COVID and the flu is that the flu, and I know that I talk all the time with the people who go within the lungs and look at like Argento and others who do the bronchoscopies, which are the doctors, by the way, at the very highest risk of all. And what they see, the damage this virus comes, they have never seen it with the flu. This is much, much worse. And about 20% of people with COVID, which is 1 out of 5, gets very, very sick. And then again, many survive it, but some of them also get left with a lot of damage. I mean, so it is definitely worse than the flu, but I don't know about the other countries, but I know based on the US data, we can clearly see that here,
Based on your experience, your knowledge, because I admire your knowledge and your experience and you as a human being, and most of all, your intelligence and who you are. Based on what you're saying right now and based on what Mr. Loathetti said, we have statistics today that whether people stay inside, we have been in quarantine 7-8 weeks now, people are diagnosed with COVID-19. So what really does it matter if we open up the country and we are just taking precautions instead of closing the country, where this will create a huger domino effect, because it's not only losing a loved one, it's the advances and people not having money to pay their mortgages, their rents, to feed their children. Suicide has increased, they said 44% in many areas, domestic violence, alcohol. So this is a huger domino effect than what we are just focusing on the COVID. So why, or what you would suggest, why close down the country and let everything let collapse when we can gradually open up the country. Because whether we stay in or whether we don't, it's proven that many of us will get COVID.
So here is, I don't think.
What would you advise the governor to do, in other words? If you were on his team and you took your advice, what advice would you give Governor Pritzker?
Okay, let me just say first that this is a big debate, obviously. And the big debate is even more challenging because although nobody really admits that openly, the reality is that we have not seen what we were expecting to see. We were hoping we will have a much flatter, more curve, and it has not happened yet. So this can be interpreted in many ways, but clearly, we know from other countries that eventually the curve flattens. Here's what I believe. I believe that the country should not be rushed to open without the right conditions. And it should be done. I think the administration had come up with a plan that there should be a trend going down within 2 weeks. Now everybody's ignoring it. All the states say, we'll do whatever, So I will advise, especially because there are different parts of the same state. It's very different to be in Chicago, in downtown Chicago, and to be in downstate Illinois, where there are, 100 people out. So I think there should be gradual reopening, but only if there is a trend of improvement, and we have to be a little more patient. But to reopen, you cannot just reopen without having masks, protection. There are people who go out there and they demonstrate, say, I don't want to wear a mask. That's a very bad idea. It's one thing to demonstrate, I want to get my job back, but then to say, I don't want to wear a mask, that's my personal freedom. How about you killing other people? Is that freedom too? So I think there are some things that are really wrong. Like, I think when the country reopens, everybody should be with a mask, and they should keep distances. It has to be done in an organized way. And the other thing is, there has to be some sort of massive testing. People, because then you can track down gradually, if you test positive, and you have to, there are so many unemployed people right now that the best thing the government or the states can do is to employ them to go and do this tracking. Like, if we can test a lot of people, these people can go and follow and find out if it is a positive, who did you talk to? Try to gradually. That's what South Korea did. That's how they did to try to bring it down. So the country cannot stay closed forever. That's obvious. It's going to collapse. But it has to open with the right conditions. And one is protection for people with masks and all that stuff. And the second is with intense testing. The testing is no question that the more you test, the better the chances to control this. I think everybody agrees on that right now. I don't think that, but we're not there yet. That's the problem. We don't have the capacity to, although it's getting much better now, it's like much, much better. We still don't have the capacity to test massively. And the most worrisome thing is that there is no a process for tracking. But I think overall, we are in the right direction. But you see my point, right? We need to prepare well to reopen.
I see your point, but I feel sorry for those that don't have food for their kids.
I completely agree.
Suicide. Yeah. So, this process can take months and months and months. Where do you kind of say, okay, let's open, like you said, let's wear masks, let's take protection. I mean, this has totally collapsed the entire world, and it's extremely, very, very upsetting. As a mother, as a Christian, as a human being, you look and see what it has done to the entire world, and you feel pain and empathy for the world.
But right now the world is slowly reopening. Germany, is reopening, but look at their data. They have really flattened the curve. I don't know what they did, why they have done better than us, but the curve in Germany is flat. Spain, which was really bad, and Italy, they have not really flattened the curve, but they are getting better. England remains close, and the cases there still go up sky high. England has not controlled anything. The US is, in some areas it has. If you go to New York, it's dropping, Washington is dropping, Chicago is not dropping yet, but it will. So it's a matter of balancing when do you make the call. And the problem in this country is that we are a very large country, very diverse, very different states, very different people. Most people with small businesses cannot last more than a month or two. It's very hard on them. So it's a very tough situation, and I understand the anxiety, but I really believe the government, the states, they need, and that's why we've been trying, the cancer center directors have been asking for the Defense Production Act to put together a massive production of masks and all that stuff so everybody can have it, So it's good, but things are getting overall better. That's the whole point here.
Dr. Platanias, all I can say about Germany, which really stands out, is because we lived there for 6 years. I always tell people the very first week we were there, we put all of our garbage in 2 cans and didn't recycle. And the following day, all the garbage came in front of the door and with separate boxes and said, you need to recycle everything. And then I stopped the same week. I stopped on the road to get some flowers, and I didn't turn my car off. And as soon as I stepped out, the car behind me stopped and came up, tapped on my shoulder and said, you're ruining the environment. So I know how the Germans operate.
Follow the rules.
They follow the rules to the T, and we don't. I mean, that's the difference. So you just pointed out the fact that people don't put on masks. Yeah, I walk around the subdivision here. I've gone to a couple of stores, and everybody knows they're supposed to wear masks, and they don't. And so outside we had 2 parties, several parties, people are getting together and stuff like that. I think that's the difference. And we're kind of in the middle. We're not as bad as Italy maybe or other places, but that's what happens.
Yeah, the funny thing is that Greece, which in theory, you will expect, and they all wear masks there and the numbers are going down. It's really amazing. And that's completely the opposite of what you would have expected from Greeks. But they have done unbelievable.
I think they did it because they know how bad the health system is in Greece. And they figured if I even go to the hospital and wait out in the hallway, I'm dead. So I might as well
You're right.
Dr. Platanias, this is Charlene Seaman. Hi, how are you?
Good, how are you?
Scott's face is up there because he put the picture up. First, I want to say I love the color of your walls behind you, the purple.
Thank you. Yeah.
I wanted to ask a question because I've heard that there were possibly cases here like in December, January, and I have a friend who lives in California, and she had a real bad infection, upper respiratory infection. Her husband did too, and she lost her sense of taste and smell. And she went back to the doctor and he said, I don't know why, because we weren't really talking about COVID-19 right now. So she actually, now she had the test, but she didn't show positive, but he did an antigen test and she has the antibodies. So I guess they're saying that she had, she had that. And Scott and I both were really sick in January with upper respiratory infections. He coughed for 2 months, steroids, everything. And now our doctors suggested, that we take that test to see if we possibly had it, because I think there were cases here, because I've heard other people say the same thing they had. And her doctor at the time couldn't figure out why she had no taste or no, smell.
Yeah. So if the antibody test was positive, for sure she had an infection. That's what I was saying before. We don't know if that protects her, but we know that shows that there was past infection. That's how we diagnose past infections, by doing the antibody test. So, and it's not surprising at all that there might have been sporadic infections earlier, December or even November. But then the whole thing exploded sometime in March, in early March. But it's very likely, and it's consistent with the way viruses spread, that this could have started long before we thought it did. And that's what now this type of study saw. That's a very good point, actually.
Yeah. Yeah, because, it was kind of, she was, going crazy because she couldn't smell, she couldn't taste anything.
That's a classic thing for COVID, couldn't smell and couldn't taste. And that's a very specific thing because we don't get that with other viruses. And
Yeah.
And she had positive tests. That goes along with that, so.
What about now there's this, for children, I actually posted something on, in New York City, they have a lot of children that are coming down with they're showing COVID positivity in the tests, and they're coming down with rash and extremely high heart rates. And they're saying it's some kind of form of it. Did you hear anything about that or?
So what is that?
It's for children. They said there's something that's coming out with children that they are testing positive for COVID, but they don't have the normal symptoms. They have like rash, they can't breathe, or their heart rate's going like 160 and they're very high fevers. So they think that it's some kind of that kids are getting now but they're showing COVID, but it's not the same symptoms.
I wanted to ask you also about this. It's they have symptoms like Kawasaki symptoms.
Yes.
And, is there a possible? Is there a normal for a virus to show so many variations in the expressions of symptoms?
Absolutely. There is wide variation, especially this virus is very multifaceted, very diverse in its clinical presentation. So it's very, the children have been a big puzzle because now children get less COVID, and that's a good thing, but there could be things that we still are missing, obviously. But we have seen this virus affects many parts of we're writing a review right now. Actually, we will be submitting it tomorrow. And it affects from everything you can imagine, from the blood, the coagulation cascade, it affects the heart, it shuts down the kidneys. If you get very sick, many patients, we didn't know that at the beginning, but many patients get kidney failure and they go on dialysis. So it has very diverse ways it acts. And the reason is, there is this, the receptor for the virus, is this thing that we call ACE2. And some of you may be on what we call, there is a blood pressure medication, ACE inhibitors. So that's a receptor related that is related to a receptor that we use for some blood pressure medications and is expressed in different parts of the body. And that's why it affects many different parts of the body, So it's a complicated story there.
Doctor, this is still Charlene, although I may sound a little bit different. So we have to count our blessings, as Elaine reminds us, and all of us in Chicago are very fortunate to have great scientists like you and your team, both for what you do for cancer and what you're doing now. So thank you, and thank you for taking our questions. I have a little bit more of an esoteric question, which picks up on Elaine's point, which is, at some point, there is also opportunity cost in the form of death and health consequences with keeping the economy closed down. And we hear about all these models that are used to predict what morbidity, mortality will be from this, how it's going, associated with COVID. Are there any models that plug in sort of the dire health consequences of economic decline that would help us as a society make some determinations? Because at some point, the cost of keeping the economy closed in terms of death and illness will be greater than the cost of the disease by opening it up.
So that's a very good question. In fact, we're starting right now a study with the support of the Hippocratic Foundation to try to understand the impact that COVID-19 has on cancer patients.
Mm.
You know, when patients stop going to appointments or delaying treatments, no, this has not been measured accurately right now. So there is a point, that, you know, keeping everything closed, that it starts affecting patients in a different way. Another major concern, for instance, medical concern, is children that don't go to the pediatrician's appointments and they don't get the vaccines for measles and other things. So down the road, we may get an outbreak of measles because kids were not being vaccinated on time. So it's a very tough balance there between what, you know, how to, but there is also another thing. If the economy, let's say the rush, there is this urgency that we need to do something for the economy. If it reopens and COVID goes out of control and the health system starts collapsing, the economy will be destroyed forever. You know, that's the difference. Right now, I think the economy will recover and it's going to be like, you know, it's going to be fine. But if we rush and then there is a huge spike and then there is a second collapse and it needs to close again, then the damage will be much worse, you know. So it's very hard to predict these things. It's a very difficult call for everyone involved. So, but I think the safest way is to listen this moment to the doctors and scientists to make sure, because they want to, everybody wants the economy to reopen, and not to drive it purely by economics. And that's, I'm glad I'm not the one making this call. I'm sure it's a very difficult call, but that's the concern. There are many things at play. This is a lose-lose situation. No matter how you take it, it's very tough. But you know, there is hope though, because there are other countries right now that are coming out of it. And I think the US will come out of it too. It's just, you know, to minimize the damage. That's the whole thing, obviously.
Now, you're not doing cancer treatments at the hospital now, right? The clinic. I mean, people are not getting their cancer treatments, correct?
No, that's not correct. We do give, oh, absolutely. We bring patients who need treatments. Yeah, absolutely. They can and get it. We only delay things that can be delayed. You cannot delay. So we have decreased. We bring less patients in the hospital to avoid being congested. And there are many patients who have been cured from cancer and they just come for a follow-up. So this is not urgent to be seen. That can be delayed. So, but patients who need the treatment, we really try not to delay unless it can be delayed. There are some forms that, so there are many different scenarios, but in general, absolutely, we're fully functional and treat the patients, yes.
What consequences are you seeing or concern you about all the delay and cancellation of elective treatments on the healthcare system? In other words, nationally, there's reports of a lot of hospitals and a lot of people being laid off because elective treatments and appointments have been postponed.
Yeah.
Do you see that as a major issue?
Yeah, of course. All health systems have been dealt a very severe blow. The finances of all the hospitals or the medical schools. So that's a big challenge too. But that's the same thing. That's what's happening to everyone is the economy. But yeah, the hospitals have been dealt significantly, not like everywhere, you know, there are many reports. So this is something expected when you minimize the number of patients who go and all that stuff. Hopefully it will not be anything long lasting. I think, especially in Chicago, we have many good hospital systems, and I believe all this will be reversible and fine. But, for some other places it's even more challenging. So.
Yeah, no, the reason I asked about that, because I have a couple of friends who were not going to their you know, their treatments, and they've given them to stay at home, like the pill form of chemo. I can't think of the name of the drug right now, but they didn't get their different treatments that they go for on a regular basis. And as you know, because even with Scott, he had to get his treatments right every third week, or it would, you know, possibly push back the treatment as far as.
So some of these things are safe and okay to do. So I don't know the specific issues, but yes, I mean, people have been trying to change things in a way that, you know, they will minimize exposure to the virus. But at some point, you know, again, there is the elective surgeries that we've been delaying. At some point, they will become not elective. I mean, at some point, you need to do them. So so in Chicago, in Illinois, the governor's directions for May right now is that for some elective surgeries to be happening, and we are doing them already. There are some, so there is already some partial, very slow reopening, at least with the hospitals. There is guidance for that, and surgeries start happening again. And it's going to be very challenging because at some point it may get, you know, a month or two from now, it may get a lot of people may come all together. So that's something else that we are preparing, and there is a whole plan for this. As, you know, we're doing a plan, other people doing plans. That's one of the most important things you can do, how to coordinate reopening.
Now, what about, I heard this too, out on University of Chicago has shut down their ER unit, and are basically just taking patients that are already, you know, like patients of doctors in the hospital or things, that they're not just taking emergency patients. Now, I don't know if that's true or what. Has that cut down too?
I don't know. It's very hard to believe that they will shut down. Really, I don't think that. They may not take COVID patients transfers from other hospitals, but the emergency room, they will not close it like that. I don't think so.
Okay.
You know, it's a two-way street. And Eleni organized a mass drive to get some protective gear. What are some of the things that we could do to help you?
Well, you know, obviously protective equipment. Right now, there is a lot of protective equipment for the clinicians dealing with the patients. I think it's going to be more challenging for the researchers, and that's what we work, and I talked with Eleni about that. There is also stuff like, you know, like, I think we will be okay, but, you know, even like, how do you call it? The hand sanitizers, stuff like this. It has been difficult to order. On the clinical side, now people can get them. On the research side, it's more difficult to get. But right before the big thing happened, I remember I had told my staff, and we did order. That was right at the end. After that, the next few days, you couldn't order it anymore. And we had ordered sanitizers to put in its lab.
Dr. Platanias, how many gallons of sanitizers do you want?
I'll talk to you later.
Just call me. I'll get your trailer. Don't worry. We'll donate it to you. Don't worry. Just keep up doing the great work that you're doing. You have to find the vaccine yesterday, not tomorrow, yesterday.
I'm aware. Thank you.
Dr. Platanias, you should also mention how you and your team have pivoted not only to focus on cancer research, but COVID as well, right? So
yeah, no, that's, and what we plan to use some of the Hippocratic support is, there are questions relating to COVID and cancer. You know, we're a cancer center, but we have projects right now that we are selecting that will address questions that I was trying to decrease the impact of COVID on cancer patients. And also because COVID can be more damaging to cancer patients, we do a lot of COVID research. We just want to develop drugs. I even in my own lab, you know, I was never doing viral research, but because of some different, some pathways we were studying in cancer, that maybe overlap with some pathways affected by the virus. We're doing right now, if you do Frank, Eleni knows Frank, he was in the lab right now working on COVID research, so yeah. So
the
we
one that
do,
did the research that we got the award for the brain cancer.
yeah, Frank. So yes, I think that everybody wants to do anything. If you come up with an idea, we're gonna go and do it right away. And
Dr. Platanias, can I ask you a question, please?
yes.
They said that in the news, I think it was yesterday, if I remember correct, that Northwestern invented some kind of a patch that they put on the neck.
Yeah.
Can you explain
It's
to
5
us-
o'clock.
Can you explain to us what is that?
Yeah, that's a group in Evanston who are not doctors. They are electronics people. And what he did is, this guy, John Roberts, who I know very well, we collaborate. So they created a small chip. It's a small thing that you put there, and it gives signals. It's very sensitive. It has a sensor, and it can pick if you start coughing, sneezing, I don't know, your temperature goes up. It puts the whole thing together, and there are symptoms for COVID, and it starts getting the signals, analyzing. It's like a microcomputer there, and is a way to follow up, the evolution of COVID. So in fact, I'm planning to talk to him about this to understand better, because that's John is like this, there are electronics and others.
Yes, it's very, very interesting what they said, and it can detect someone that has COVID next to you.
Yeah, no, I think
So sensitive, it says.
Yeah.
I know you're very busy, Dr. Platanias. We can see that everybody's blowing your phone up. And I know this time is very valuable for you. And we appreciate what you're doing for us. Yes. But you need to get on the news more
Thank
often,
you.
okay?
Yeah.
Okay.
Thank you, Dr. Platanias.
Thank you.
Thank you,
I was
doctor.
gonna say that next week I have a conflict, and I already mentioned to Eleni, so that we're gonna do it in 2 weeks. We were talking instead of next Thursday after. Is that okay with everyone?
Sure.
Yes, thank you very much for doing this.
Okay. Thank you so
Bye
much,
now.
everyone.
Thank
Nice
you.
talking to
Dr. Platanias. Thank you.
Bye-bye.
For you.
Happy
Thank you
Father's Day,
so
everyone.
much.
Thank you.
Thank